As the Baylor family, we value one another and believe that our mission calls us to be leaders and servants. Therefore, we're committed to taking precautions to put family first to help prevent the spread of COVID-19 and protect each other, our campus, our cherished traditions, and our community. Because guidelines can change quickly, it's the responsibility of each employee to monitor CDC and Baylor guidelines for updates or changes. For the most current guidance and additional resources, please visit Baylor's Keep Working Return to Campus webpage at baylor.edu/coronavirus. A more detailed version of the content provided in this video may also be found on Baylor's Keep Working website. All faculty and staff are expected to fully comply with the return to work expectations and COVID-19 prevention guidelines. Failure to do so may result in corrective action, up to and including termination. While we are presenting university-wide workplace expectations and guidelines in this video, certain departments or jobs may have more restrictive requirements based on their specific needs. Managers will share any other job-specific guidelines with you. Let's begin by talking about the Swiss cheese model of prevention. When we think about behaviors that can reduce the risk of COVID-19, none are perfect. Multiple overlapping strategies, however, can improve overall effectiveness. Imagine a single slice of Swiss cheese. The holes represent a weakness where danger can pass through. Yet, if several slices are stacked together, the holes in one slice are covered by the cheese in another slice. Although each of the approaches outlined in this video has holes, when stacked together, the shortcomings in one approach are mitigated by another. The more layers of behaviors and precautions, the more likely the holes are covered, and the more Baylor's faculty, staff, students, and community are protected. In our Swiss cheese model, the different strategies are represented by phased staffing, self-screening, face coverings, social distancing, and hygiene. Let's first consider phased staffing. Each division and school leadership team created a flexible plan for a phased approach to resuming work on campus based on the number of personnel in the department, physical work setting to allow for proper social distancing, prioritization of work activities, and service levels required for effective operations. Each team's model is different, but all are built for safely providing the important services needed for university operation. The next level is self-screening. Faculty and staff must self-screen daily for any new or worsening symptoms of possible COVID-19 before going into work on campus. COVID-19 symptoms include fever over 100 degrees Fahrenheit, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. If you are experiencing any of these symptoms, do not come to work. Contact your healthcare provider for guidance and notify your supervisor of the needed absence. Additionally, if you have known close contact with a person who is lab confirmed to have COVID-19, whether you are experiencing symptoms or not, do not come to work and follow CDC guidelines and self-quarantine for 14 days. During the period of self-quarantine, you can continue to work remotely unless you are otherwise on leave. Should you start to experience symptoms, notify your supervisor, seek medical treatment, and stay home in a non-work status in order to support full recovery. There are a number of factors and conditions that might place you at higher risk for COVID-19. Know your risks and monitor your symptoms closely. As an employee, you are not required to disclose if you are at a high risk for COVID-19 based on CDC guidelines and have concerns regarding returning to on-campus work, but you may discuss an accommodation for remote work with your manager or through Baylor HR. Supervisors in HR will work with each employee who is requesting accommodations to care for themselves or a family member with high-risk conditions and discuss options that support a healthy and safe work environment while determining ways to complete position responsibilities. If you become ill or test positive for COVID-19, keep these things in mind. For most people with COVID-19, isolation and precautions can generally be discontinued 10 days after symptom onset, assuming you are symptom-free. A limited number of people with severe illness may warrant extended isolation and precautions for up to 20 days after symptom onset. Your doctor or an infection control expert should be consulted. Those who test positive but never develop symptoms may return to work 10 days after the date of the positive test. Additionally, Baylor requires returning employees to be symptom-free and fever-free without fever-reducing medication for at least 24 hours before returning to work. Managers should consult with their HR consultant immediately if an employee notifies you that they may have been exposed to someone who has tested positive, if they are being tested for COVID-19 due to symptoms, or if they receive a positive COVID-19 diagnosis. Your HR consultant will guide you through the next steps. Face masks or cloth face coverings are the next layer of protection. Face coverings are required by all faculty, staff, students, and visitors on the Baylor campus. There are a few exceptions to this, including if you are working alone inside an individual office, or if you are actively eating and drinking in an area appropriately designated for eating and drinking purposes. Some employees may have medical reasons that create challenges to wearing face coverings. Those employees may request a reasonable accommodation by contacting Baylor's Human Resources Office. Here are some tips for safely wearing a face covering. Reusable cloth face coverings should only be worn one day at a time and need to be properly laundered before using again. Wash your hands or use hand sanitizer prior to handling the face covering and avoid touching the front of the face covering. When taking off a face covering, do not touch the front or any other surface of the face covering. Be careful not to touch your eyes, nose, or mouth when removing the face covering, and wash or sanitize your hands immediately after removing. It is a good idea to keep a spare face covering with you, just in case you need it. Next is social distancing. Keeping space between you and others is one of the best tools we have to avoid being exposed to coronavirus and slowing its spread. Because the virus can be spread by infected people without symptoms, it's important to maintain social distancing wherever possible. Employees must follow these social distancing practices. Stay about 6 feet, or approximately 2 arms length from other people at all times. Stay out of crowded places and avoid mass gatherings. Limit in-person meetings to small groups that do not exceed 25% of a room's capacity, unless an official Baylor COVID-19 room capacity sign provides other guidance. And be sure attendees can maintain social distance. Use Microsoft Teams and Zoom meetings wherever possible. The final strategy in our model is basic hygiene. If you do not have on your cloth face covering, remember to always cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And wash your hands with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, sneezing, or touching your face. If soap and water are not readily available, use a hand sanitizer containing at least 60% alcohol. At the office, Baylor's housekeeping teams will clean office and workspaces based on CDC guidelines, and departments will be provided with sanitizing products for shared use equipment so that they have the ability to disinfect areas after each use, such as department reception areas, break rooms and kitchenettes, workrooms, conference rooms, shared computers, printers, or other technology, light switches, or doorknobs. Here are a few other precautions that we ask faculty and staff to take. If you work in an open environment, be sure to maintain social distance from coworkers. It is required that you wear a face covering at all times while in a shared workspace. If you work in a walled office, no more than one person should be in the same room unless social distancing can be consistently maintained. If more than one person is in a room, face coverings should be worn at all times. Be sure to wear your face covering when in a reception receiving area or while walking in hallways and in break rooms, conference rooms, and other meeting locations. Do not share anyone else's face covering or personal protective equipment, phones, computer equipment, or workspace. If vehicles or work equipment must be shared, precaution should be taken to sanitize them between use. Avoid handshakes and hugs. One recommended greeting for Baylor Bears is simply raising a paw and saying "sick 'em." Use of elevators should be limited where possible to avoid close proximity with others in a confined space. Temporary signage outside of elevators will tell you the number of people allowed in the elevator at a time. If you need to use an elevator, you must wear a face covering regardless of traveling alone or with others, and avoid touching the elevator buttons with your exposed hands or fingers. Wash your hands or use an alcohol-based hand sanitizer upon departing the elevator. Avoid entering or exiting buildings during rush periods as feasible. Visitors are not permitted in campus offices. This does not preclude family ride drop-offs and pickups or emergency on-campus trips. Where business-critical, in-person visits must occur, business guests must wear a face covering and maintain social distancing. Visitors who have had known exposure to persons with COVID-19 within the last 14 days or who are exhibiting symptoms of COVID-19 are not allowed on campus. Meals and lunches provided by departments should be avoided if possible. If a necessity, meals should be boxed or the entity delivering the meal should serve. Disposable plasticware or wrapped silverware must be used, and hand sanitizer must be available. If you are eating in your work environment, like a break room or office, maintain social distancing between you and others. Don't sit facing one another. Only remove your face covering in order to eat, then put it back on, and wipe all surfaces, including table, refrigerator handle, coffee machine, etc., after use. During an emergency evacuation, you still need to evacuate using the safest, most expedient means possible. Be sure to wear your face covering, and once outside in your department's evacuation assembly area, maintain social distance from others. Baylor is committed to supporting your total well-being, and that includes your mental and emotional well-being. Baylor provides a range of services and innovative programming, and you can learn more online about programs like the Employee Assistance Program, MD Live, and other resources at baylor.edu/hr/wellbeing. You are an important member of the Baylor family. When we work together and put family first, we can keep one another safe and prevent the spread of COVID-19 in our community. For a more detailed description of these guidelines, visit the Keep Working section at baylor.edu/coronavirus.